Hi everyone. It's great to see so many people here.
Woo!
I'm Matt. I'm a paediatric advanced nurse practitioner in a children's intensive care in London. I've been a nurse since 2004. I went into children's nursing for a variety of reasons. Children are fun to work with. They don't complain as much as adults do when they're sick. And the volume of pee, poo and vomit they produce is nothing compared to what adults produce. And for the most part, I've loved it until this year. COVID struck, and all of a sudden, the PICU I worked in discharged all our children to other hospitals, and we became an adult COVID ICU. I continued in my A&P role with my A&P colleagues, despite never having looked after sick adults before. The nurses who for the most part had only ever looked after children became AICU nurses. The medical team who had not worked with adults since being FY1s became AICU doctors and consultants. Play specialists helped staff don and doff PPE. Paediatric ward nurses became AICU float nurses. Newly qualified nurses on our preceptorship programme had to suddenly look after sick adults when they were supposed to be learning to look after sick children. Physios, dietitians and numerous other professions had to change roles overnight. This was all done whilst having to get used to wearing full PPE every shift and dealing with COVID. To all my adult nursing colleagues, you guys are amazing. How you deal with the sheer volume of bodily substances that adults produce on a daily basis, I will never know. We got through it. Some of the team got sick but recovered. But sadly, that was not the same for the rest of the NHS. Too many of our colleagues have died due to the incompetence of Boris Johnson and Matt Hancock. We were no way isolated in what we were doing, with similar things happening up and down the country and all around the world. Healthcare staff being thrust into new and scary roles. There was the clapping and the generous gifts from companies, restaurants and individuals that made the experience slightly less horrendous. All the while though, through this period, we have had a farcical response from government, with lies about PPE, issuing PPE to staff that was 8 years out of date, distorting numbers to make things look slightly less crap than they are, defending senior officials who ignored the quarantine rules they created with farcical excuses about testing their eyes. Maybe if lessons had been learned from other countries that are ahead of us in the first wave, and steps were taken earlier on by our government, who have been notoriously slow to react throughout this pandemic, things wouldn't have been as bad as they were. We may not have had the disaster in care homes and the disastrous testing regime that is still failing us to this date. We didn't enjoy being an AICU, but we got on with it because we had to. The teamwork was amazing, and the success stories made it worthwhile. This was replicated up and down the country. Then came the announcement that frontline workers were being rewarded for their contribution in the fight against COVID. Finally, as healthcare staff, we were going to get some tangible recognition from the government for our efforts. But no. Teachers, consultants, dentists, the military and numerous other professions all got pay rises, and I certainly don't begrudge any of them this. They have all had their lives and jobs turned upside down by COVID. And after doing homeschooling with my kids, I have a newfound respect for teachers.
Woo.
But what about the healthcare staff? What do we get? More lies and disinformation. We have already received a significant pay rise, according to our health secretary, who is lurching from one disastrous decision to another. Our woefully incompetent Prime Minister spreads more lies and disinformation by telling the House of Commons we have had a 12.5% pay rise, when in reality we were given another below inflation pay deal, meaning healthcare staff have now had their pay cut by 20% over the last 10 years. We deserve better. Enough is enough.
Enough is enough is enough.
However, there is a problem amongst healthcare staff that government exploits. We care so much for others, but we don't care enough for ourselves and what is happening to the professions that we love. I became an RCN rep shortly after the ballot on industrial action in 2017 because I felt the RCN needed to do better. By coming involved, I could make a difference. Whilst I was at RCN HQ for training, we were discussing the results of the ballot. Out of 270,000 eligible members, only 50,000 responded to the ballot. I was shocked at this response being so low, but I was told by the staff at RCN that this was the biggest response to a ballot they have ever had. For every 5 members who could have voted in that ballot, only 1 did. And this is why the government treat us the way they do. Now, until yesterday, I wasn't expecting to speak here. But if I can stand up here and speak to all of you, then every one of you can go and speak to 2, 5, or even 10 members of staff, friends, colleagues, family members, and get them engaged in this movement. Engage with your unions. Get them to do what you want them to do. There are a huge number of healthcare staff in the NHS. If we all work together like we have during the COVID pandemic and speak with one voice, it will be impossible for government